For many new moms, all of the congratulations and best wishes from family and friends would seem to promise a bright future. But for some, the reality of the transition to parenthood can trigger depression and anxiety. Welcome to Advancing Health, a podcast from the American Hospital Association. I'm Tom Hetterly with AHA Communications. For any number of reasons, bringing a new life into the world can lead to a period of depression and anxiety for new parents. This is more than the traditional baby blues, and by identifying and treating it, new moms can rediscover the joy of parenthood, as we hear in this moving podcast.
So my pregnancy was pretty stressful. The week I found out I was pregnant, my mom was also diagnosed with stage 4 cancer and was told that her treatment options were really limited. And being the daughter of a first-generation low-income family, I felt a lot of pressure in my pregnancy to juggle my mom's health as well as taking care of my own health and my unborn child's health at the time. I think initially there's a lot of talk about the birthing process and there's a lot of support around that, but I felt like there was very little talk about some of the potential mental health struggles that a mom can go through, a first-time mom. A lot of times you're told, motherhood's amazing, all these expectations of what motherhood will look like. I was pretty much floored by how much I would struggle mentally.
That was Anna Ma. She's a first-time mom of a 1-year-old boy. You'll be hearing more about her journey through perinatal depression and what support enabled her to get through it. Perinatal depression, including mood and anxiety disorders, are one of the most common complications of pregnancy, affecting 1 in 7 women during pregnancy or in the first year after giving birth. Postpartum depression is more than the baby blues. It can cause intense sadness and anxiety, and in severe cases, moms may think about actually harming themselves or their babies. Many of the signs of postpartum depression and anxiety, like lack of sleep and hormone swings, are present in all new parents. And as a result, providers and patients may not recognize that the symptoms are more severe than the run-of-the-mill baby blues. Welcome to Beyond Birth, a podcast series on how healthcare organizations can support the social and emotional needs of pregnant people and new parents. I'm Julia Resnick, Director of Strategic Initiatives at the American Hospital Association. In today's episode, we'll explore perinatal depression and where new parents can go for resources and support. You'll hear from Laura Laporte, Clinical Research Manager with the Perinatal Depression Program at Endeavor Health, formerly North Shore University Health System in Evanston, Illinois. Endeavor is a suburban Chicago-based integrated healthcare system with 7 hospitals. Endeavor Health is also the principal teaching affiliate for University of Chicago's Pritzker School of Medicine. You'll hear again from Anna Ma, a high school guidance counselor and new mom who used Endeavor Health's Mom's Line to help her through her postpartum depression. We'll start with Laura. She's an expert in perinatal depression. In our conversation, she shared her insights into how perinatal depression can present in new parents.
In a nutshell, she's not herself. And she has a sense that something is wrong. She might conflate what the way she's feeling with what motherhood is supposed to be. So that can start to send off a little bit of feelings of hopelessness. So you might see guilt or shame, loss of interest or pleasure in things you used to enjoy, crying, sadness. But with perinatal depression or anxiety, there's some unique features. So we see much more agitation. So a lot more maybe some somatic, like shaking, trembling, overwhelmed. There's a ruminative quality to the experience for moms. So the key things that a perinatal therapist would look for are women who say, I just don't feel like myself. And I'm not sleeping at night when I get a chance to sleep. They're irritable. And then they try to keep it together. They're snapping at family. Then they feel guilty and ashamed and like a bad mom. And the cycle repeats itself. A lot of the work that we do are breaking down the myths of motherhood.
For Anna, these myths informed her expectations of motherhood. But that vision was not her reality. Anna experienced these issues acutely after the birth of her son. She shared how she came to realize that she was experiencing postpartum depression and anxiety.
I started seeing a lot of the warning signs of postpartum depression anxiety. So, for example, I was having crying spells. Um, I started developing insomnia. Um, I would be anxious even when nothing was wrong with my son and just checking the baby monitor like constantly. And that's when I realized, okay, this level of anxiety and depression isn't normal. And to be honest, I being someone with a mental health professional background, I didn't see it right away. It took a bit for me to say, hey, something's not going on here, and my functioning is being impacted.
And that something is precisely what Endeavor Health's Perinatal Depression Program addresses. Back in my conversation with Laura, she talked about the origins of Endeavor Health's long term commitment to supporting new moms' mental health.
So I like to say that we are the silver lining of a tragedy. So a local family lost their daughter to postpartum suicide, and they approached our department chairman, Dr. Richard Silver. They wanted to create something where women could be helped. And that was the birth of screening, universal depression and anxiety screening at our program. So, a way of us identifying patients. And then we also established the country's first 24/7 free confidential perinatal mood and anxiety disorders hotline. It's answered live by licensed mental health professionals. So, we had a way of reaching out to women through screening, and they could reach in through the hotline.
Out of that tragedy grew Endeavor Health's Perinatal Depression Program, one of the first of its kind in the U.S. Laura, who has been part of the program for 18 years, shared how the program engages with pregnant and postpartum people.
One of the things that North Shore did that was really pioneering is we were one of the first people to actually screen in pregnancy as well as the postpartum. And so we know that we were asking a lot of our medical staff, our busy nurses and physicians, nurse midwives, and their medical staff. So what we decided to do was time the screening with glucose tolerance testing that happens around 24 to 28 weeks in pregnancy, and patients are a captive audience because they're waiting for their results. We also, and that's consistent with onset in pregnancy of those mood disorders. And then in the postpartum, women are screened again at their postpartum visit. So their opportunity when they can see their obstetric provider again is when we screen them.
So, what happens if they screen positive?
We have those screens are entered into an electronic medical record. The social work staff of the program get alerted immediately, and most women are phoned the same day by a social worker who's very skilled in making unsolicited phone calls to patients and building rapport and educating them and really being a broker of treatment.
And then there's also the other direction where women can call the hotline, yes?
Yes, absolutely. So our hotline is given out liberally by all of our physicians. Physicians actually feel really comfortable calling themselves if they have a reticent woman in their office who thinks she's too afraid to contact, or they're worried they're not going to answer the phone if a social worker calls, so they can call jointly. We have a wonderful staff of licensed master's level and PhD level therapists who are skilled in the perinatal time as well. Our local hotline we've gotten calls at our local hotline from 47 different states, 7 different countries. So we will serve you no matter, it's incredible.
What is the number for that hotline?
Wonderful question. 866-364-MOMS. 866-364-6667.
That is pretty easy to remember.
Yeah, we tried.
Though Anna didn't receive her pregnancy care through Endeavor, the Mom's Line was there for her when she needed support beyond what her family and friends could offer.
So my sister, thank God, reached out to me and was like, I see a difference in you. I would call her frequently because we're very close. And she had a really good friend that used a support group in Illinois called Beyond the Baby Blues. Amazing program. It connected me to other moms. And the founder of that organization told me about the Mom's Line. So I jotted down that number and I put it on my bulletin board. And I remember having some really, really bad episodes of anxiety and depression in the middle of the night. And so I would call that number And the Moms Line, the staff on there are so wonderful. I love that it was free and that it was readily available. It's a 24/7 hotline in Illinois. A lot of times I would just call that line and talk to some of the moms. I believe most of the volunteers on that hotline are moms, and they have extensive training. And so I would give those moms a call at 2 o'clock in the morning, sometimes 5 or 6 o'clock in the morning, and they would help me just ground myself and talk about resources. And some of them even shared their own experiences, which I really, really appreciated. Because when you're going through postpartum depression or anxiety, you feel so much guilt, so much shame, and it's really easy to isolate yourself. But having a network and just the support readily available is really, really important for moms, especially a first time mom. I could see the warning signs in me. And so I was like, I need to get support. I need to get better. My son was a huge motivator for me, just saying that I need to get better. I want to connect with him. I don't, what I'm feeling right now doesn't feel normal. And I need to get that support.
As a society, we need to change the conversation around the challenges of being a new parent. It isn't all beautifully curated Instagram photos and cute stories. No matter how much you love your baby, it can still be hard. And it is okay to admit that you're struggling with the job of being a parent. We need to eliminate the stigma around therapy and medication for perinatal depression. We need to normalize discussions around mental health and screen new parents for depression. Laura spoke to the changes in the culture she's seen around maternal mental health recently.
I've been doing this work for almost 20 years, and there seems to be, I think COVID was actually helpful in this way, that we've really seen how important mental health is. On an individual level, just by screening and having, medical residents, for example, being trained in this, talking with their patients about it, legitimizes it in an outpatient office. I think the other thing is we are very skilled as social workers and therapists in our program to approach patients with destigmatizing language, very educational, very, not so are you having these terrible thoughts and feelings? If this happens to many women, is this happening to you? So there's a way that we approach them that's very delicate. I always tell moms there is a difference between the baby and the job of parenting. Right? So women feel like they are unable to speak negatively about the experience of motherhood because that means somehow they're a bad mom or they don't love their baby. That's not true. Where you are able to reconcile positive and negative feelings in the perinatal time by recognizing this is my baby, but the job is what I'm struggling with. And you're allowed to have feelings of this is really hard. I don't like being woken up. I'm scared all the time. Yeah, it's a tough job.
It's so important to be able to name that you can love your baby to the end of the world and also just be struggling.
You can complain about the job if you want.
About the job.
Well, listen, yes.
If it isn't obvious, the joys of being a parent come with their own set of challenges. After nearly 20 years of Endeavor's Perinatal Depression Program, it has had incredible reach, impacting patients and new parents from across the country. I asked Laura about the impact of the program and how they know they're making a difference.
One of the things that we had the foresight to do was to find some funding to do a program evaluation. We were pretty pioneering when we started screening. We wanted to see what impact we're having. Overwhelmingly, patients really appreciated screening, and 87% of them said, I'm actually more pleased with my obstetrician and nurse midwife because they're doing this for me. And we were really surprised to learn things like 2/3 of them said, oh, just by looking at this 10-question questionnaire, the Edinburgh Postnatal Depression Scale, now I know what to look for. So just giving a questionnaire was educational for patients. We were also surprised that some of them, I think maybe 75% of them said, I didn't even know really how I was doing until I took a look at this. We listened to our patients and we adjusted accordingly.
That's wonderful. And as that broker, do you know how many patients you've connected with mental health resources?
This is a statistic I absolutely love quoting, and it keeps rising. So our hotline just celebrated 20 years. We have served over 14,000 callers. And again, from all over the world, from 7 different countries, 47 different states. And so there's clearly a need for this type of work. Our team has personally contacted through our screening program 10,000 mothers. And most of the women we work with in either case always get what we like to say is a little care package. So these are, again, trying to be that broker of treatment, trying to make sure that there are no gaps in linking someone to treatment. We will look at give them robust resources. Where do you live? What are your barriers? How do we bypass them for you? So we do that for hotline callers as well as screened patients.
That is incredible. So you've been at this for 18 years, and I assume you've learned some lessons that you know now that you wish you knew when you got started. Are there any of those that you can share with us?
One thing that I would have loved is to be better at capturing accurate race, ethnicity, and language data, for example. And those are initiatives we're really trying to address now, more DE&I, more explicitly. I think historically, we didn't want to ask some of those questions. We thought, well, it doesn't really matter. Does it really matter when we're working clinically with somebody? How would that be perceived? But now we're realizing that it is an important need. We do need to know that. We were seeing some of those barriers to care. We conducted interviews and we realized that patients are falling through the cracks if they get a referral where that doesn't work. If you get a referral, that person doesn't call you back. It's an insurance or provider mismatch. It's just not working for them. So we had to come up with ways of addressing that. And now we're looking at the future holds, we're looking at novel ways of using technology to bypass some of those barriers, like worked on a National Institute of Mental Health grant to develop an app for women that they could use in lieu of psychotherapy for those who can't access it with really good success. And I'm also working on a multi-center trial where we're looking at the differences between Zoom-based psychotherapy and in-person psychotherapy. So we're always trying to find ways. I think the main thing that our future will hold is how do we bypass barriers to treatment? How do we continue to be the best brokers of treatment we can be?
Getting the right support and treatment has been crucial for Anna's journey through perinatal depression. Anna shared how she's doing now and her advice for healthcare organizations and providers working with new moms.
I'm doing a lot better. It's crazy when I compare where I was a year ago and where I am now. I am doing 100 times better. It took a lot of hard work, lots of hard work. This past year has been easily the hardest year of my life. Like a lot of places that jumped in and helped me because, a lot of times they say it takes a village to raise a child. It also takes a village to get a mom out of severe postpartum anxiety and depression. And you need multiple supports in place. I had a lot of support from friends and family members, but they weren't moms themselves. And so having a network of people that understand what you're going through or who have been there is crucial to getting better. I really want to encourage healthcare providers and organizations to really educate staff on postpartum anxiety and depression. And so I just feel like if there can be more support or at least a network, like I don't expect doctors to treat me in that manner, but if they can have a network of mental health providers with a perinatal focus, maybe a network of things like the Mom's Line that you can call when you are having anxiety or depressive symptoms, having that information readily available to moms when they leave the hospital or when they come in for their checkup is huge. The other thing that really I want to stress is making sure that providers are using the perinatal depression screener. That was really helpful in helping me identify like where I was at in my health and when I needed to get help and support. It's such a huge life change. And I know my husband and I talked about this. We've been together for a really long time, years and years, but we've been only parents together for a short time. So like just the change in the dynamics and in your relationships and how that can impact mental health for both mom and dad.
We'll close this episode with some thoughts from Anna. Given her journey, I wanted to hear her insights for new moms and parents.
I want to tell new moms to have patience and love and grace for themselves. To be a good mom, you need to take care of yourself. And I had a really hard time with that. I, in the beginning, felt so much guilt and shame for leaving my son to go get treatment and just feeling like such a failure. And I realized that it's not my fault. I didn't ask for postpartum depression or anxiety to happen, that I wanted to be a good mom and that's what I needed to do. And so, what I want to tell moms who are experiencing any symptoms of PPD or PPA is to have patience and hope. Our society, I feel, says, oh, enjoy these years. These are the best years of motherhood and all these things. If it's not, that's okay too. It doesn't make you a bad mom for feeling that way. And there's no rule book on how to be a good mom. I just want to tell those moms to hang on and want to stress the importance of seeking help. That's how I got better was having the courage to join support groups, find a therapist. If you don't find someone that you like initially, keep trying. Just really making sure that you have a village, not only for your child, but for yourself, so that you can get better and be there for your kid.
Healthcare organizations and providers are a key piece of that village that new parents so badly need. Being there to support their patients, detect when something is amiss, and connect them with resources. And they need to continue to normalize conversations around perinatal depression and anxiety. A big thank you to Laura Laporte for her expertise and Anna Ma for sharing her story with us. Anna, because of your openness and vulnerability, you will help other new parents feel less alone. You can reach Endeavor Health's Moms Line at 1-866-364-MOMS. That is 1-866-364-6667. You can also visit AHA's growing library of resources on improving maternal health at www.aha.org/Better Health for Mothers and Babies. Thank you for tuning into the Beyond Birth podcast series. If you missed either of the first 2 episodes, you can find them at aha.org or wherever you get your podcasts. We hope you found these stories useful and help you provide better care for the moms and parents in your community. Stay tuned for future podcasts from Advancing Health on maternal health and child health in the months to come.